Joining me now is James Chen. He's the founder of Clearly, a campaign designed to promote greater awareness of the global vision issue. James, I want to ask you about your website. I read that on Clearly, poor vision is the largest unmet disability in the world today, and that a third of the world's population, that is 2.5 billion people, suffer from poor vision just because they don't have access to glasses. So that is a massive number. What is the one thing that can make a difference today?
Well, it's the one thing that can make a difference would be for everyone everywhere to have access to a vision screening, and then for 90% of the people with poor vision, it's about getting a pair of glasses.
Myopia is a major problem in China, especially among young people, and I was looking at the numbers. They seem to get worse or larger as young children turn into teenagers, and we know that more kids than ever are on screens, phones, computers. What are some of the causes, and what are the answers here?
Well, myopia is a problem worldwide. The WHO estimates that about a third of children in the world today struggle with myopia, and that number will go up to 50% by the year 2050. In China, that's an even bigger problem. In 2018, school children aged 12 to 14, about 72% struggled with myopia, and so that's when the government decided to declare it as an eye health as an epidemic in China.
And what do you think that stems from? Is it access? Is it hereditary? Where does it begin?
Well, that's an interesting question, and no one has the answers. But for sure, the problem is getting worse because of screen time. But there are also effects like the rural to urban transition for a lot of children. And one of the most interesting things is that children early on, we think, need sunlight, enough access to sunlight. And of course, because of children in classrooms, we think there's not enough sunlight. So the Clearly campaign is helping to fund a study in China around this phenomenon, whether there needs to be more access to sunlight in classrooms.
You mentioned rural areas. How easy or difficult is it to get eye initiatives, especially established in these areas, not just in China, but around the world?
It is a big challenge. In China today, only 1 out of 7 children who need glasses have access to glasses. And the two key challenges, number one is that there is an issue with access because of getting the vision screening, and then also to be able to get glasses. Screening because while China has 5 times the recommended number of ophthalmologists per capita, most of these ophthalmologists are in urban areas. So the rural areas are underserved. So that's one issue. And of course, glasses are much more expensive because of distribution issues in rural areas. And then the most interesting challenge is actually that for generations, there's been this misconception that actually wearing glasses makes your eyes worse, your vision worse. And so this is the kind of thing that is a big challenge for local government officials to be able to tackle.
And James, this issue has been dear to your heart for a long time. Would you say there has been, or has there been, global progress in improving eye health around the world? And what more needs to be done?
Well, the most important thing is really, we have the answer: glasses, right? 90% of people with poor vision, their vision can be improved and makes them much more functional by having glasses. But the challenge is more of a political will, and there, China, of course, is taking the lead by declaring this an epidemic and taking steps to try and solve it. And other countries, we're hoping will be making the same kind of a commitment, and we hope that within our lifetimes that everyone will have access to vision correction. For children, the key things, number one is sunlight, getting enough sunlight particularly when they're younger. Number two is managing screen time, right? We have this saying 20, 20, 20, 20 minutes of screen time, then, look at something 20 meters away for 20 seconds. That will help children and actually everybody to improve their eye health. And then thirdly is, of course, it's for everyone everywhere. It's access to vision screening and glasses for everyone everywhere.